Hello friends, welcome back in the channel of Clinical Care Insight. We have started a new lecture series in the subject of pharmacology, and in the first chapter, the name of the chapter is Introduction to the Pharmacology, and in this chapter, in the first lecture, we will have the general discussion. We already discussed about what is the mean by the pharmacology, a branch of medicine which study about the drugs, study about the different kind of drug, their effect, okay? We also seen various, you can say, terminologies, okay? We also undergone through some, you can say, the subfield of pharmacology. We seen about the historical aspect of the pharmacology, and we also seen that there are two important aspects of pharmacology. The one is called as the pharmacokinetics, another one is called as the pharmacodynamics. Fine. Now, in today's lecture, we are going to discuss about the route of drug administration. Now, we already know that drug is a chemical entity or a chemical compound which is administered in a person's body to make them free from infection, okay, free from the unhealthy condition, okay, and try to recover in a healthy condition. So now administrating the medicines possesses certain routes, okay. In our body, there are already, you can say, assigned certain routes, okay, via which we administer the medicine. So in today's lecture, we are going to discuss about the route of administration of medicine. Fine. So what things we're gonna discuss, here is today's lecture outline. First, we will deal with the introductory part as we discussed in our previous lecture. Then we will discuss that what are the factors, okay, which governs and which decide the, you can say, the routes, okay, which decide the routes. Then we will discuss about the bioavailability of drugs, okay, bioavailability of drugs. Then the drug metabolism, indication, their contraindication, and also we will also discuss some of the rights, okay, of drug administration. Now, why it is important to understand about the route of drug administration? How you can define first the route of drug administration? Write down the topic name. Route of drug administration. Drug administration. See, it is a, you can say, a choice. It is a choice in a person's body where you are going to administer the medicine. Probably you heard about the oral route. Okay, generally we take the medicines, we take the drugs from our oral route, no? And but there are certain other routes like the intravenous route. We take the vaccine in the through the, you can say, intramuscular route. Apart from that, there are insulin shots which is given to the by the another route called as the intracutaneous routes, isn't it? So these are certain routes. Fine. And probably you've seen that you are not allowed to administer the medicine by your own choice, okay. It also depends upon the chemistry of a drug, okay. It also depends upon the choice of drug administration, or you can say the route of drug administration. It depends upon the various factors. It depends upon the various factors. Now, the first factor, if we're talking about the factors which governs the choice of the route, then first factor is the drug chemistry. First is the drug chemistry. Now, what you understood by this drug chemistry? Drug chemistry means, you know, that not all the drugs are only just in the solid form. Yeah, some drugs are in the form of solid, some are in the form of liquid, yeah, and some are in the form of gas. Their drug chemical, you can say, the chemistry, a physical state of the drug is different, okay. It means the route should be, you can say, aligned to the drug chemistry. Means you cannot inject the solid drug, okay, through the IV. Are you able to do it? No? Fine. So solid generally, or most of the time, the solid form of the drug is administered through the oral cavity, okay, through the oral route or through the rectal route. Fine. And generally, the liquid physical state of a drug is administered through the IV. Fine. And also through the rectal route. Then the gases, it is for the one, you can say, the special kind of route, okay, special kind of route called as the intranasal route, okay, intranasal route. So these are the drugs. So choice of drug administration, or you can say the choice of route of the drug administrations is the first factor is the drug chemistry. Apart from that, you know that patient can have the multiple, you can say, problem. Patient may have the, you can say, the multiple problems, like some of the patients, they have problem in their mouth. Suppose there is oral surgery. So you cannot administer the drug through the, you can say, oral cavity. You have to look for the one alternative route of drug administration. Fine. So the route of drug administration, the choice of route of drug administration is also depends upon the patient condition. Yeah, it also depends upon the patient condition. Okay, it's not only limited to the surgeries. There are sometimes the patients about the patient mental status, if they are conscious, or maybe they are not conscious, they are unconscious. So you have to, you can say, change the route. Okay, you have to change the route. But generally, the choice of route is, you can say, depends upon, like, it's a common sense. It's mainly on the common sense, and the common sense. Apart from that, the convenient, okay, which is easy one, which is easy to access. Fine. So common sense and convenient are the, you can, the fundamental feature to choose the route of drug administration. But the route of drugs is also depends upon the drug chemistry. Apart from that, the patient's condition. And you know that sometimes we need the, you can say, the proper or optimum effect of a drug. Okay, and sometimes we need the, you can say, the minimal or the sub-minimal level of drug effect. Suppose suppose a patient have the, you can say, cardiac arrest. Fine. So if you administer the oral medications, it will take time. Okay, and if you provide the intravenous through the intravenous route, okay, it lessens the time. Okay, it's overcome the time period. Fine. So why this happen? Through the oral route, there is a slow effect of the drug. Okay, and through the intravenous route, there is a fast effect of the drug. Why this happening? So for understanding this thing, you have to look for a bit the drug metabolism, how drug is metabolized in our body. We will have the detailed discussion in our upcoming lectures, but for a while you just understand that drug metabolism means when you take the medicine, it goes inside your body, okay, and how it changes into its active form, okay, how it's gonna affect and the, you can say, the specific receptor or specific site, how it's reached. So the first thing is, whenever you take the drugs, it's undergo the metabolism. Okay, it's undergo the metabolism. Take the example of the through the oral route. Okay, oral route. Now, in oral route, what is happening? You taken the medicine, okay, it goes through your GIT tract. It goes through your GIT tract. And in the GIT tract, you know that for anything which comes inside our body, our enzyme will act on that. Our enzyme will act on that. If this comes through the GIT, our enzyme will act on those, you can say, the taken products or taken things. So here the taken things is a drug. So the drug also have to undergo certain reactions, okay, and that all reaction is collectively called as the metabolism. So generally, a drug metabolized, if we're talking about the main primary organ of drug metabolism, then it is our liver. It is our liver, okay, liver. Now, drug, if you're talking about through the oral route or it's in the form of solid, okay, then this drug have to disintegrate. Disintegration means, first you write it down, disintegration. Disintegration means this macro size of a drug, okay, macro size of the drug have to broken down into the smaller microforms, okay, and this process is called as the disintegration. Am I clear? Yeah, this process is called as the disintegration. Now, this disintegration, first the taken medicine undergo the disintegration and then it come into the liver. Then in the liver, you know that there are various enzymes. Okay, there are various enzymes we will discuss when we take in the separate system. We will discuss about the enzymes. But for a while, you just understand that liver have the various enzymes. Okay, and these enzymes work on the micro form of drugs. Okay, or you can say the micro particles of drugs, which comes after the disintegration. Okay. This liver enzyme will work on the microparticles, fine, and thereby this liver enzyme make these microparticles active, and then it will work upon the, you can say, the desired site, okay, desired site wherever this medication is needed, it will work. Now, this process of, you can say, drug metabolism lessen or is overcome the effect of the drug. Fine, you take in the, suppose this medicine is about the 100% effect. Okay, now after the disintegration, the percentage come, okay, it's come down, it become less, and after, you can say, coming to the liver, after the working of the enzyme, it's become more less. Okay, and whatever the, you can say, effect will you can say save after the liver metabolism, this is called as the bioavailability of a drug. This is called as the bioavailability of drug. Write it down. Bioavailability of drug. Now, once again, I will just define it once again. What we discussing? We are discussing the metabolism of the drugs, and we said that the metabolism of the drug means whenever we take in the drugs, it undergoes certain chemical reaction, and all chemical reaction is collectively called as the drug metabolism. Now, if we taking the example through the oral route, if we take in any medicine, any tablet, first it disintegrates. It changes from the macromolecular size to the microparticles, and these microparticles goes to the liver, okay, and there will be a further enzymatic reaction, fine, and when these enzymes will work on these micro fine particles of the drug, okay, drug effect become less, and whatever effect will save after the liver metabolism, this is called as the bioavailability of the drug. This bioavailability percentage of the drug, okay, it is the one which is the, you can say, the effective part of the drug, which is the effective portion of the drug. Got it? Fine. So this is through the this is through the oral route. Now suppose if you providing the same medicine through the IV, then what happens? If you provide through the IV, it bypasses the liver, isn't it? If you provide through the IV, then it will bypasses the liver. Okay, the drug which is administered through the IV, the intravenous route, it will not reach to the liver. It will directly go to the desired site. Thereby, there is a 100% of bioavailability of the drug. And it's explained why in the emergency conditions, patients is you can say the patient's choice of route of drug administration is the IV or through the other, you can say, the routes. Are you getting the points? Because IV provide 100% bioavailability, whereas through the oral route there is a lessen or there is a less bioavailability. Got it? Fine? No problem. So this is a brief idea about the drug metabolism. We will have the detailed lecture now. Come to the point. We are discussing the the route of drug administration. Fine. Now you have some sort of idea that the route of drug administration is worthwhile to discuss, because as a healthcare professional, as a nurse, as a doctor, we are actively, you can say, participating in administering the medicine, okay, in the administration of the medicines. And you know that each route have their unique contraindication. Okay, we will discuss the contraindication as well as the indications, but you have to keep in your mind that each route have their own, you can say, the contraindication. Okay, so you have to understand it in a very essence way. Fine, and you will understood. I will try to make you understood this. Fine. This is about the drug of route administration. Now we are going to discuss what are the routes. Okay, what are the possible routes via which we can administer the medicine. Okay, so basically we will discussing now about the classification of routes.